Good morning and welcome to Trevor Phillips on Sunday. They call New York the city that never sleeps. Well, for the last 24 hours at least, it's been hard to tear your eyes away from the drama in the Big Apple. Yesterday morning, the city woke to a sombre remembrance 20 years on from the tragedy of 9/11, led by Presidents Biden, Obama and Clinton. And last night, if they did get to bed, they would have been marvelling at the titanic tennis final between two players, neither of whom was yet born on that day. And if I may say so, perhaps reflecting not just by Emma Raducanu and Leylah Fernandez's brilliance on the court, but if anyone saw their after-match interviews, they would have been struck by the graciousness and poise of both young women. Boris Johnson's been known to wield a racket from time to time. He finally served up his social care proposals this week, along with a tax rise and a benefit cut. Next week, he's promising a volley of new ideas on how we're going to manage COVID through the winter. We're going to see what our guests make of it. Did he smash it, or is it all spin? Enough with the tennis already. Joining us today from the government, I'll be speaking to the Health Secretary, Sajid Javid. Scotland's First Minister, Nicola Sturgeon, will be here as the SNP give it one more push for IndyRef 2 at their party conference this weekend. The Shadow Health Secretary, Jonathan Ashworth, will be joining me to talk about a huge week for public health spending. And I'll also be talking to former Foreign Secretary Jack Straw about the lessons learned from 9/11 20 years on. But first, I'm joined by Health Secretary Sajid Javid. Mr. Javid, good morning. Did you see the match last night?
I saw most of it, and I've got to say, just like the rest of the country, I was just absolutely thrilled to see what Emma had done. I mean, what a phenomenal performance, but what also just a huge inspiration to all of us.
Wasn't it extraordinary, not to extend this, I thought the eloquence of the two young women afterwards and their graciousness to each other should be a lesson to politics, shouldn't it?
It's a lesson to us all. I mean, to go through that, and both with that desire to win, but whatever the result, how they sort of come together, they embrace each other afterwards. I think there's lessons there for all of us.
All right, well, let's talk about the hostilities. Opened this morning with an investigation by a newspaper into your colleague Priti Patel, who, it is alleged, has broken the lobbying rules again. Is she becoming a liability to your government?
No, not at all. I mean, I've done that job, being Home Secretary. I know just how difficult a job it is, and I think she's been doing really well over the last couple of years, and it certainly is one of the most challenging jobs in government. And I remember when I had that job, when you're waking up almost every day and finding there's something going on that's is something to do with the Home Office, and it's a big job, and I think she's doing a good job.
Yeah, but she could probably do without, not to extend the tennis metaphor too much, without yet more unforced errors by meeting people she oughtn't to be meeting.
Look, I haven't seen that report, so I'm not sure what you're referring to. But look, I think that, as I say, it's a really tough job, and she's doing really well. There's so many things that she's already done with the legislation that's been put forward. But I also know, as Home Secretary, you also do a huge amount that never gets into the public eye, because it's not something you can ever talk about publicly. And I think it's obvious to me, having done that job, that she's carrying out that part of the work here, the stuff that's never in the public, incredibly well.
OK, let's talk about how you're doing your job. Can we
Please
expect that there will be no need for PCR tests when we travel in the near future?
Well, Trevor, if I may, just sort of set out our plans for the future, and I will respond to that question as well. Now that we're entering autumn and winter, it's something that COVID and other viruses usually like. The Prime Minister this week will be setting out our plans to manage COVID over the coming few months. And in that, we'll be making it clear that, first of all, our vaccine program is working. It's been phenomenally successful. We now got over 80% of people over the age of 16 double vaccinated, some 90% at least having one jab. And it's been fantastic in reducing the rate of hospitalization, something we all wanted to see. alongside that, it's been complemented by your fantastic new treatments, a juggernaut of a testing regime, and also a surveillance program, probably one of the best in the world. So, we've got a huge number of defences. Of course, we still want to remain very cautious. And there are some things that, when it comes to travel, for example, there are some rules that are going to have to remain in place. But the PCR test that's required upon your return to UK from certain countries, look, I want to try and get rid of that as soon as I possibly can. I'm not going to make that decision right now, but I've already asked officials that the moment we can, let's get rid of these kind of intrusions, the cost that generates for families, particularly families just trying to go out on holiday. We shouldn't be keeping anything like that in place for a second longer than is absolutely necessary.
OK, so the PCR tests gone ASAP. What about vaccines for 12 to 15-year-olds? Also ASAP?
Well, I think your viewers will know that we have been looking at that. I'm not in a position to make a final decision on it. I've received advice a week or so ago from the JCVI, our committee of experts. Their advice was that I should ask the chief medical officers of the UK, the 4 chief officers in the UK, to take a look at not just the health aspects of vaccination, but whether there were any broader reasons that it might be in the welfare of children. And that's what I've done. And they need to be given the time to look at this, and I'll wait to see what they have to say.
Have they given? When will they give you their advice?
I'm not going to push them. They need to take their time. It's independent advice, as it should be. They need to take their time. I don't think they'll be taking that much longer. But in the meantime, I have asked the department to work with schools, the school vaccination teams, to start preparing, just in case we have a situation where their advice is to recommend it, and that if the government accepts that, then I just want to be able to go ahead with it.
Isn't this a little bit of a relaxed approach to something that is really rather urgent? We're already seeing cases spiking in Scotland after schools opened there a few weeks ago. And actually, you're saying that we're focusing on the vaccine. You said that this morning as a first line of defence. Yeah. But actually, we're seeing warning signs from elsewhere in the world, Israel, for example, that the effectiveness of the vaccine might be waning. Are you being a bit complacent about the situation?
No, not at all. I think, look, let's deal with the vaccinations there, both potentially for children, but also potentially boosters, and I'll come on to that. For vaccinating children, if we are to make such a decision, it has to be led by the experts. We have to listen to expert opinion. Now, as I've said, the JCVI have already looked at this. They made a recommendation to me to pass it, to have another look from a different aspect from other medical experts, and that's the right way to do it. And I think it's fair to say that adults are going to be naturally more hesitant about vaccinating their children than they were about vaccinating themselves. That's perfectly understandable. That's true the world over. So if we're going to do this, it has to be done properly, and it must not be rushed. When it comes to,
be done soon.
Well, hopefully soon. And as I say, in anticipation of the final advice, I want to be ready. And that's why the system is getting ready for this. But Can I also just turn to boosters, because you talked about waning immunity. We now, of course, do know more about this virus and vaccination than we ever knew before. There is evidence of waning immunity, particularly in older people, more vulnerable people. And we're already taking action on that. So, for example, just a week ago, I announced that those people that are immunosuppressed, that should get a third jab, not as part of their primary treatment. That has already started. And in terms of a general booster program, we have asked the JCVI to look into this. They gave me interim advice a month or so ago where they supported this, but they said they wanted to do some further work. We've given them the time to do that work, but I believe we will be able to start our booster program subject to their final advice on schedule this month.
Good. OK, now, when the Prime Minister speaks to us this week about his programme for the autumn and winter, will that include vaccine passports of the kind that the Scots have already decided they will have? That is to say, when I go clubbing, will I need to have a vaccine passport?
Well, Trevor, I know you like clubbing. I know why this is so important to you. So let me answer your question. That look, I think if we went down the road of vaccine passports or vaccine certification, as it's sometimes called, that's a big decision for any government to make. We have been looking at that. We've been open about that. Instinctively, I don't like the idea at all of people having to, let's say, present papers to do basic things. So if we do that, it has to be something that is looked at very carefully and something that we believe that has to be done with no alternative. With the vaccination rates. With the vaccination rates rising, for example, with 16 and 17-year-olds, we only started just last month. Now over 50% of 16 and 17-year-olds are already vaccinated. I think we need to take that into account and make a final decision, but I hope we can avoid it.
Well, you say you hope you can avoid it, but this is a precautionary issue. I mean, vaccine passports are proposed because we need to protect people, well, coming back to the clubs, people like myself and Michael Gove, who are in and out of clubs every week. We need to protect people. Are you ruling it out, or is it still on the table?
Look, I'm not here today to rule that out. We haven't made a final decision as a government. We have been looking at it. We've been very open about that. But as I've said, that I think if we did something like that, it has to be supported by the evidence. And it has to be something that is absolutely necessary with no alternative. So, as I say, I hope we can avoid it.
What is the evidence telling you about the big danger this winter? Is it more COVID Delta variant? Is it a new variant? Or is it conventional flu? What is the evidence telling you that we need to be most concerned about? Well,
winter, autumn, it's not just COVID that likes that part of the year, it's other viruses too. And you've just mentioned another really important thing that we've got to prepare for, and that is flu. I've already mentioned the preparations for boosters, and I think that's going to be an important part of our defence. But when it comes to flu, what we've been planning in the past few weeks is the biggest flu vaccination programme this country has ever seen. Why am I concerned about that? Because last year we didn't have much flu because of all the other controls that were in place, and that means just is a lot less immunity around to flu than normal. And we know that in some years, in a bad flu year, just how terrible it can be. So alongside our continuing COVID vaccine program, we're going to have our biggest ever flu program. And I would say to those people listening that certainly those that are over 50, getting your flu jab is going to be as important as having your COVID jab.
All right, let's talk about the other big announcement of last week, when you broke your manifesto pledge in order to introduce a new health and social care levy, a new tax. You've asked us to believe that the 12 billion that you're going to raise each year for the next 3 years will eventually go into social care. When you're in banking, would you have said to a customer, I've just raised the interest rate on your loan, but don't worry, trust me, would you give me your mortgage to look after? Why would we trust what you say after you've broken not one, but 2 manifesto pledges?
Well, first, can I just turn to the manifesto pledges, since you started with that? You're right. We made a commitment that we wouldn't raise certain taxes, and that included national insurance. Now, we had an option. Given the global pandemic, we had an option. We could doggedly sort of stick to that manifesto commitment and say, look, you know what? We know there's a global pandemic. We know that there's unprecedented strain on our health and social care systems. They need more support, but we're going to ignore that because we've got a manifesto commitment. Or we could have said, we're going to do the responsible thing, and the circumstances have changed. And I think it's no exaggeration to say that no one had predicted this pandemic, and that it has changed, so many things. And we could respond to that in a responsible way. And that's what we've done. And I wasn't prepared to see, as the health secretary, for example, with the NHS, with the growth that we've been seeing in the waiting list, I wasn't prepared to see that waiting list being any higher than it needs to be. I want that waiting list to be tackled. And the way to do it is to make sure that the resources are there and they're also making the right reforms.
Aha. Now, look, that's a great justification. But you could be, if you're still health secretary a year from now, and you might want to tell me something about the reshuffle speculation if you want. You could be coming on here next year and giving me another great and smooth reason for why you've changed your mind. Let me ask you if you would give us a commitment. You're saying that you'll switch the money into social care when the COVID emergency allows and waiting lists allow you to get to somewhere. Set a level. Is that going to happen when waiting lists get back to pre-COVID level? Let's say, for example, the level of 2010 when Tories came into government of 2.5 million. Would you say that's when social care gets the money?
What I'll say, Trevor, is that first of all, of the announcement, the money that we said that will be raised, the total 36 billion, some 5.4 billion of that will be going to social care, no matter what happens. That's going to be going into social care to support the new cap, to support a more generous means-tested system, to give local councils more support, more workplace training. So that's going to go into social care. Over time, over the sort of those 3 years, the NHS would have made maximum use, huge use in tackling the waiting list with the money that it will be getting. But also that cap that we've announced, the £86,000 cap on lifetime costs, that only sort of starts to bite in later years, you're beyond the 3 years. And that's why this levy, I'm certain, will be able to cover that cost and those costs in the years beyond the next parliamentary period.
There's a timing thing here, though. Let me tell you what they're saying in local government. They're saying that when you start spending the money on social care, which is 2023, the money that you've raised from this new tax will still be going into the NHS. And you know who's going to have to fill the gap in those 3 years? Local government, through raising the council tax. And what you will then do is say, we raised the tax, but local government, spendthrift, they're not doing their part. You are going to dump this on local councils, aren't you?
No, not at all. I mean, already today, spending on adult social care, some in normal times around £20 billion a year. That's a combination of funding from central government and locally raised funds. What we've announced this week is a top-up on that to provide, as I say, the more workplace training, this new system of a cap and better means testing. So it's a top-up of that. It will remain a combination of funds, and each year it will be determined based on need. But the changes that we've announced today will make it a stronger system, and local authorities will continue to play a hugely important role in that.
OK. Look, a quick question on universal credit, and you can do this in yes and no. Are you going to cut universal credit by £20 a week?
We're going to end the temporary increase in universal credit.
So the answer, yes. That cut, you're not budging on that at all?
The increase, which was temporary, will be ended as planned at the end of this month.
It's been reported this weekend that the Prime Minister reckons that he wants to stay in Downing Street for another decade. Well, obviously, the electorate's going to decide that, but they're going to want to know why he wants to stay there. And there's a curious thing here. You spend trillions of public money. You intrude on individual freedom down to telling us what we can and cannot wear on our faces. And you boast about defending the most socialist health system in Europe. What exactly is conservative about the Tories right now?
Well, if you look at, you talked about the intrusion on freedom, and that, you're right to raise that. We should never intrude on people's freedom unless there was a really, really good reason to do so. What we've seen in the last couple of years is the government respond to a global emergency, respond with the most successful vaccination program the world has ever seen, and help us get through this very difficult period, including having to break a manifesto promise to make sure that we show people just how responsible and serious this government is about meeting the people's challenges. We've done that, even the package we've talked about, but we've done that in a responsible way by being honest and raising a tax instead of borrowing and mortgaging the future of the next generation. That's very conservative too. But we are always looking to make sure that as a country that we support businesses, we support the economy so it can continue to grow. And there's no doubt as we start to see that growth now, we can create the opportunities that everyone would expect a Conservative government to do so.
All right, well, look, let me ask you a question which essentially is about whether you don't come back on here and give me some more reasons for why you're not really a Tory. Will you commit to no more tax rises in this Parliament?
Look, I'm not Chancellor anymore. If you get the Chancellor on your show, you can ask him about tax questions. What I can tell you, as a Conservative and as a proud member of a Conservative government, we should always be trying to keep taxes as low as we possibly can, and making sure that we recognise that when you have tax, any type of tax, you're taking away hard-working people's money, and every single penny should be spent wisely. All
right, let me put this another way then. Deal between you, Sajid Javid, and me, Trevor Phillips. If somebody comes forward, Chancellor or Prime Minister, with a proposal for more tax rises in this Parliament, will you, Sajid Javid, oppose those tax rises?
I think we should be, if we have to spend more somewhere else, I think that we should always be trying first to see where we can make savings to pay for that, not extra tax rises. And tax rises should always be the last resort. It's been right to do it on this occasion, but we should always try to avoid it.
Last resort for tax rises. Thank you very much, Sajid Javid.
Thank you very much.
Now, what happened in New York and Washington 20 years ago changed the world. 2 decades on, the West is still fighting a war against Islamist terror. Or is it? It's still not clear whether the American withdrawal from Kabul is simply fulfilling a promise, or whether it heralds the end of an era of liberal interventionism. My next guest, Jack Straw, was Foreign Secretary in Tony Blair's government when the attacks took place. He joins me now from Oxfordshire. Jack Straw, yesterday must have brought back some vivid memories of that day in 2001. What stood out for you personally?
Yesterday or in 2001?
Well, when you think back to 2001, what stands out?
I mean, what stands out is simply the way that everything changed in an instant. The period really between the collapse of the Berlin Wall and after things had stabilised, and certainly the relative stabilisation in the Balkans, and September the 10th, 2001, had been a pretty calm one internationally. So not a huge amount was going on. Suddenly all that changed, and particularly for the Americans, because they had become very used over decades and decades to seeing their mainland territory as completely inviolable to foreign enemies. And indeed, there'd been no attack on the US mainland since the British Navy and Marines attacked Washington, D.C. and burnt the White House. But that was in 1812. So it really was a really deep trauma. And that led to the atmosphere in which the decisions were made, not only in respect of the invasion of Afghanistan, but subsequently in respect of Iraq. Sorry, go on.
I wanted to ask, on that day, did you fear that London would also be a target at that time?
For sure, yes, of course. I don't even remember, but air traffic was closed down. We were really very worried indeed, because these guys had the capability to hijack 4 passenger planes and have trained pilots to run into the World Trade Center, the Pentagon, and what they were hoping was either the White House or Capitol Hill. They could easily have done that in London, but for example, taken out Canary Wharf and the whole of the Palace of Westminster, House of Commons. So we were extremely worried about it indeed.
Let's talk about what's happened since, and obviously the most present issue is Afghanistan. It's obviously early days there, but do you believe the Taliban when they say that they're going to be different this time?
Well, I think they'll be a bit different because in the last 20 years, the vast majority of people in Afghanistan, particularly women, but very many men as well, have learnt to enjoy their freedoms. And they're going to be resisting having those taken away. Also, the country is far more reliant on the West than ever it was. I mean, just for example, there were virtually no mobile telephones 20 years ago. Everybody's got a mobile telephone now, and that requires reliance on overseas technology. They'll also be under pressure, not only from the West, but also from Russia and China. And although Russia and China want to make a point against the West, they are also petrified about Islamic extremism in their own countries as well as in neighboring Afghanistan. So they will be under greater pressure. But the question is, have they feel like changed their spots? I mean, my instinct is they haven't. So they'll be, their instinct will be to do what they did before. A key to how they behave is the attitude of Pakistan. And it's not often sufficiently discussed this, but just bear in mind that the Inter-Services Intelligence Directorate of Pakistan, part of their defense operation, has been up to its neck in ventriloquizing and supporting the Taliban over decades. So their attitude matters as well.
What would you do about Pakistan then? I mean, how can the West use its influence in this respect?
With difficulty, but I mean, partly listen to them and take their advice. I mean, because after all, the reason they have this extraordinarily ambiguous relationship with the Taliban and with other extremists on their northwest frontier is not necessarily because the very modern people in Lahore and Islamabad and Karachi support them, but they're scared of them. And it's about how you, as it were, tame this tiger. So listen to them. I mean, one of the mistakes we did make, which I now recognize but very few of us saw at the time, back in 2001, was in having no political route out of its defeat for the Taliban and for those forces who supported them. And coupled with that, we decided to conflate counter-terrorist strategy, which is absolutely right, with a counter-narcotic strategy, which frankly was a bridge too far, which is taking away the livelihood of people whilst you were also trying to get them on side on counter-terrorism. And so we need to learn from those lessons, but also be tough with them.
Briefly, if I may, is the biggest lesson that we should learn from this that our approach to tackling Islamist terror has failed, and they've won because we focused on the military when perhaps we needed to do more to focus on what I think Tony Blair this week described as the ideology, winning hearts and minds to the idea that the West way of life, democracy and so on, is better than the alternative offered by Islamists? I
mean, I don't think it's that black and white. In order to get the people to listen and reach their hearts and minds, in that situation, you had to at least push the terrorists to a draw. I mean, there are a lot of parallels here with Northern Ireland, because as long as, I mean, they're killers, leave aside their ideology. And as long as they think they're winning, they won't bother to listen. So, but we certainly should have done much, much more on hearts and minds.
Jack Straw, thank you very much for your time this morning. If you don't follow politics daily, it can be hard to make sense of what our two major parties are up to. There's an awful lot of political cross-dressing going on. The Tories are raising taxes to pay for social care. On the other hand, this week, Labour voted against an extra £36 billion of funding for the NHS, which they created. Maybe there's an explanation. Let's see. Joining me now is the Shadow Health Secretary, Jonathan Ashworth. Before we get into that, Jonathan Ashworth, we see this morning that your leader plans to publish a 14,000-word essay which will tell us who he is, what he's about, and what Labour wants. Wouldn't it be just simpler just to say we're for higher taxes or we are for a different way of organising health service rather than giving us a lot of philosophy?
Well, leaders publish essays about their core beliefs all the time. It's not unusual for a political leader to write an essay for a think tank which is associated with their party. I think the broader point here is, and I want to put this in the broader context, is that, look, I don't accept the premise of your opening remarks. I don't accept that a government imposing a punishing unfair tax rise on working people who are they also clobbering with council tax rises, with freezing their personal allowance, and a lot of them will lose £20 a week in the universal credit, is somehow a left-wing government. And actually, the vote in Parliament last week and the vote in Parliament coming up this week is whether we support that tax rise. It's not a vote on the funding allocations for the National Health Service. Of course, the Labour Party is always going to want to see more money going into the health service. But our problem with what has been announced this week is that it is a punishing unfair tax rise that won't deliver the healthcare that is needed. We won't see people treated within 18 weeks again like they were under the last Labour government. And it certainly doesn't fix social care. The cap, yes, it limits the liabilities that some people will pay out, but only benefits 1 in 7 people. What about the other 6 in 7 who see no benefit? You'll still have to pay top-up charges and fees, so you're still at risk of losing your house, so it fails on its own terms. In the small print, it suggests that because of the way the financing works, council tax will go up, or care homes will go bust, and there will still be thousands upon thousands of people in this country who don't get access to the social care they need. So I'm afraid I gently and politely disagree with the way in which you frame this.
OK, I've allowed you to explain at length why you think the government's wrong, and I hope that we've dealt with that point now, because I really want to talk about what Labour actually thinks about some practical things, as well as some broader political questions. First of all, are you going to go along with the government's likely decision to end the need for PCR tests after travel, if that's what they decide to do? So the Health Secretary seemed to suggest earlier on.
Well, we'll have to see what the proposal is when it comes before Parliament. We've had some briefing into the newspapers today that certain elements of the Coronavirus Act will be taken off the statute book. At first sight, based on the briefing, the clauses which are going to be taken off the statute book, that looks like a reasonable approach to me, but obviously we'll want to study the detail when it comes to Parliament, because there have been huge concerns about the way in which the Coronavirus Act has been misused by the authorities, and ridiculous fines have been imposed on people when they've been, sitting on park benches and so on. That's not what this legislation was aimed at. But obviously we'll want to study the detail. We can't just go off what has been briefed into Sunday newspapers, because we'll want to take a considered choice in the round.
All right, well, you're open to it. OK, let's talk about what Labour would do in relation to social care. And you've said already, we don't need to go back over the Tory proposals and all of that. Andy Burnham, your Labour colleague, wrote in the newspaper this week, "My advice to my party would be not to leave it too long before presenting a better proposal. Criticism of the Tory plan alone won't cut through unless we say what we would do." And he proposes what he calls Labour's opportunity to end this injustice, which is creation of a national care service, ask all older people to contribute whether they need care or not. And what he has also said is that we might take, a Labour government should take a chunk of someone's property if necessary. Are you up for all that?
Well, let me tell you what our alternative approach is to social care. First of all, we need to expand access to care, and we need to expand eligibility for accessing that care, so we can deliver the tailored, personalised care for people in their home, so they can stay in their home longer and not be forced into a home. At the moment, 3,000 people a day are turned down for care. You'll have people watching the programme this morning, Trevor, whose parents perhaps have got dementia, and they are battling with a complex system day in, day out, just to get some basic care for their parents, and they get turned down.
I don't want to be rude, Jonathan Ashworth. I don't want to be rude, but what you're telling me is what's wrong and what you wouldn't do. I've put to you what Andy Burnham has proposed, and I really just would like you to say, I think that's a good idea, or I don't know, or I think it's a bad idea.
Well, I am telling you what our care service will look like. because
No,
with respect...
But how are you going to provide it? Which is what Burnham and I saw John McDonnell wrote about this yesterday. How are you going to get from here to there?
Well, if you stop interrupting me, I will tell you.
Well, if you tell me, then I'll stop interrupting you.
OK, well, you've just interrupted me again, Trevor. So, if you expand eligibility with a national framework for expanding eligibility, which is what we want to see, more people will access care in their home and will not need to go into a care home or or be delayed in hospital in a bed and not able to get care out in the community. If you do that, you actually save money. The IPPR, for example, has suggested you could save £2.5 billion. So there's a £2.5 billion saving that we will reallocate to the front line of social care. Secondly, you need to raise standards and quality in care. There's 15% of care services are rated inadequate. The way in which you raise standards and move away from these dehumanising 15-minute visits where you have to make a choice between having a warm bath or having a warm meal, or you're put to bed early evening, not because you want to, but because the system tells you have to go to bed. We want to end all that by investing in staff. So what we'll do is we'll pay the staff a real living wage. Lots of the staff get less than the minimum wage at the moment. We'll get rid of these 0 hours contracts that a quarter of the staff are on, and we'll invest in their training. Thirdly, there's a number of carers in this country who get no support whatsoever. We'll give them proper respite support. And fourthly, we'll have a plan for adults with disabilities, particularly adults with learning disabilities and autism, who are currently today, around 2,000 of them, locked up in hospitals, sometimes in the most inhumane conditions, like something out of a Victorian asylum. We are going to end that as well.
May I
so
ask you a question now, please? So there is a different set of proposals on social care. Of course. May I ask you a question now, please? You've now given me a 4-point programme, part of which is to raise, you think, £2.5 billion. The Tories' plan this week is raising £12 billion. Where's your £9.5 billion coming from?
You know, I'm telling you, because we've got a reform programme, we can release savings. But there are other ways we can release savings.
£9.5 billion?
Every one of those adults in an inpatient care unit with autism or learning disabilities costs in the region of £200,000. If we looked after those people in the community, it wouldn't be costing £200,000 per person. You're looking in the region of £30,000. There's a saving. Secondly, the way in which we fund social care in this country is now through 7 different funding streams, and it is delivered through different mechanisms: Better Care Fund, Continuing Healthcare. By bringing health and care more closely aligned together, so the NHS and local authorities are planning care in local areas, you sweep away bureaucracy and you can deliver more care. And that's really important, particularly for people with dementia who are currently bounced around the system and don't get the care that they need. So by reforming care, you can actually release money to the front line.
Jonathan Ashworth, thank you very much indeed. Now, party conference season is with us once again. But it's not the fun type, at least not in Scotland, where SNP delegates will only meet online. One thing never changes, though. This autumn's Scottish National Party conference is likely to be dominated by a renewed push for a vote on independence for Scotland. Well, it would be easy to forget that for nearly 15 years, the SNP has actually led Scotland's government. They're responsible for tackling COVID, and they should be preparing to host the historic COP26 climate conference in Glasgow in just a few weeks' time. So joining me now from Glasgow is the leader of the SNP and First Minister, Nicola Sturgeon. Good morning, First Minister.
Good morning.
Now, in the programme for government you delivered to the Scottish Parliament this week, which I suppose for our international viewers might best be described as a Queen's speech for Scotland, you were clear that COVID's your number one priority. Numbers are spiking. Is Scotland in danger of a further lockdown?
No, not at the moment. I think any responsible leader in the face of this virus has to keep options open and be careful not to rule anything out. We have seen a spike in case over the past few weeks. If you go back over the summer, we spiked above UK levels at the start of July. We then came down to some of the lowest levels in the UK, and as our schools went back, we saw cases increase again. We think we're seeing that spike start to level off and stabilise. The rate of increase has slowed down. So what we're saying to people right now is that in order to drive infections down further, which we really need to do, it's vital to comply with all of the basic mitigations that we still have in place. In Scotland, for example, it's still a legal requirement in certain settings to wear face coverings. We're encouraging continued good hand hygiene, good ventilation, and of course, although it's not the law anymore, asking people to think about distance from people in other households and thinking about their overall number of contacts. So good, sensible compliance with mitigations is what we think is appropriate right now. We also, this week, got approval from the Scottish Parliament for a very targeted and limited system of vaccine certification, which we think can help us reduce transmission in some higher risk settings. So at the moment, that's our message. We're going into, as everybody across the UK is, a very challenging and difficult winter period. So it's really important that we keep a very close eye on what is happening. And lastly, the overarching message to anybody who hasn't yet done so and who is eligible is to get vaccinated. The vaccines continue to be the single most important thing any of us can do to keep ourselves safer and to keep those around us safer.
You are very clear about vaccine certification, what is popularly called the vaccine passport. But some people, including experts like Steve Reichert, the behavioural science professor in Scotland, say that you should be concerned that the introduction of certification actually could put off some of the people that you've just said you want to take the vaccine. Is that not of concern to you?
Look, Steve Reichert, who's actually on the Scottish Government's advisory body, although he's entirely independent, of course, actually in a very long and very helpful Twitter thread during the week, gave a very balanced account, set out the benefits of vaccine certification, set out, and that it goes to the point you're making here, the things we've got to guard against if it is to work as intended, and also, quite frankly, set out some of the downsides. I think in the face of
and on
the
balance,
situation,
he came
firstly,
out against it.
Look, people can take on-balance views. I think as part of a package of measures, it has a part to play. What I was going to say is, firstly, anybody who thinks there is one single magic wand solution to this virus probably hasn't learned enough over the past 18 months. And secondly, of course, any measure we take has upsides and it has downsides. I mean, if you take lockdown, for example, very, very effective at halting or significantly constraining transmission of the virus, but came with enormous costs in terms of the economy and our overall well-being as a society. So nothing is straightforward here. This is a very limited scheme. It's very similar to what is being proposed for England as well. And it has a part to play. Will it reduce the likelihood of people who are not yet vaccinated to come forward? I don't think there's any evidence of that. If you look at countries like France, that's perhaps the best example, we actually see the opposite effect. So the message is to everybody who hasn't yet come forward to take up the vaccine offer, please do so, because it protects you and it protects everybody. It doesn't eradicate the risk of transmission, but it reduces the risk of transmission, and crucially, it significantly reduces your risk of becoming seriously ill if you contract COVID.
Another big headline from your speech this week was your proposal for a national care service in Scotland, which would cover all types of needs, including disability and so on. Are you envisaging that there would be a spending cap in the way that the Prime Minister has proposed for England and Wales?
I think to ask me to address that question, Trevor, with the greatest respect, there has to first be an understanding of the completely different approach we already have in Scotland to the funding of social care. So it's not quite as simple as saying, are we going to replicate what is happening in England? So, for example,
that wasn't what I was saying. I simply just asked the question about whether there would be a cap.
But for me to answer that question with a yes or no would belie the differences, and I'm just not prepared to do it. So, for example, what we have in Scotland that doesn't exist in England is free personal and nursing care. So that means for anybody who needs social care right now, the state already meets a much higher proportion of the cost of that, your personal care needs, or if you need specialist nursing care, that is met as well. So the funding landscape is completely different. And the arguments for a funding cap south of the border are not really the same in Scotland. Now, is the overall funding of social care still a key consideration as we move forward to a national care service? Absolutely. Alongside that commitment to a new national care service, we have a commitment in Scotland to increase funding for social care over this parliamentary term by 25%. That, in a Scottish context, is equivalent to about £800 million. The National Care Service is effectively, and I'm going to oversimplify here obviously, but it's effectively about making sure that we have consistent and consistently high standards of care across the country, that there's less variation, much greater consistency, and it is also about enabling a move to supporting a workforce so that that workforce is better rewarded. The National Care Service envisages, for example, national pay bargaining and a national wage for social care workers, because one of the issues, not the only one, but one of the many issues in social care is the undervaluing of those who work in it. And there's a bigger issue there, partly because it's a predominantly female workforce. So our starting point in Scotland is just so radically and fundamentally different in England that I would just guard against lifting what is being proposed for England, whether you agree with that or not, and trying to transplant it into the Scottish context.
One thing that is clearly true about Scotland is that right now, most of the care provision is in the hands, or it's controlled to a large extent, by local authorities. And Scottish local authorities, Cosland, and indeed the City Council in Glasgow, where you have your own constituency, have said that they are uneasy about what they see as a centralisation, what you've just called consistency, but essentially you are going to take the control of care service away from local authorities in Scotland and centralise it.
So, to be frank, this is one of the key debates at the heart of this reform. And I suspect in Scotland, as we move from what we've been doing over the past few months, which is consulting, into what we are about to do, which is legislate, this is going to be one of the tensions and one of the issues that we need to resolve. And you find this often running through policy discussions about this. One person's consistency, which is what I've just said, because often the complaints and the concerns that are raised about social care is that lack of consistency, but one person's greater consistency and less variability is another person's centralisation. So we've got to make sure we get the balance of that right. And of course, we'll listen very carefully to local authorities who have expressed concerns about that. When you're trying to make a big fundamental change here, when the country came out of the Second World War, the National Health Service was created. We're trying to create a national care service out of the trauma of COVID. You can't make big reforms like that without controversial and difficult issues to try to resolve.
But this isn't really a matter of balance, is it? At the moment, social care is largely run by the local authority boards. You want to take them into, I think they're going to be called Community Health and Social Care Board, which will be under the control and funded by the Scottish Government. And I'm not making a value judgment about that, but that is a change that you want to make.
Well, look, we already have joint integration boards across different parts of Scotland. Funding for social care comes initially from the Scottish Government, flows through councils. In terms of the provision, we have a mixed provision of state through local authorities, voluntary sector and private. Private care homes, for example, are a big part of our provision. So I guess I'm not trying to shy away from this. The point I'm making is that if you take your starting point, which is I said earlier on, the starting points in Scotland are different to elsewhere in the UK, but perhaps one point of consistency is that the current arrangements around social care are not as good as they can be or as good as they should be. So if you accept that, and say we want to reform to make it better, you're going to have these debates, but let's have them. And out of those debates, let's get a care system that is fit for purpose, learns the lessons of the pandemic, and is something that in years to come we can look back on with some pride as a good thing that happened out of this COVID crisis. There'll be difficult issues in this for all governments across the UK, but I think it's time to face up to them.
You said in your speech that you want to have a further independence referendum by 2023, COVID permitting. Can we just deal with the narrow question of timing and COVID? What does that actually mean? What level of infection or hospitalisation would make a referendum impossible, given that you've just had elections in Scotland in the middle of a lockdown?
Well, we've just had elections, and of course, and just before so that I don't miss this point, the SNP won that election on a commitment to an independence referendum with a historic share of the vote. Our constituency share of the vote was higher than any party has achieved in the entire lifetime of the Scottish Parliament. So it's probably a point of context that might be important for our discussion.
Yeah, OK, fair enough, but what would stop you having the referendum? What about COVID would stop you having a referendum?
If you can let me, I'm going to try and address your question, and I'll try to do it as fully as possible. You've made the comparison with the election. This is not just about safety of polling stations. It's about making sure that as the country faces a big, important decision about its future, it's able to focus on that properly and that it doesn't have looming over that a COVID crisis. So right now, you started this interview rightly about talking about the recent spike in cases in Scotland, putting enormous pressure on our National Health Service, leading me as the First Minister to continue to advise people to take great care about their interactions. I don't think that kind of situation would be the best backdrop to the country considering and making a decision on its future. I'm not going to set a precise level of infections, but you would want to see the COVID situation under control, the pressure on our National Health Service significantly lower than it is right now, a sense that we weren't still in the acute phase of this crisis, but also crucially, and I think this is crucial, a sort of overall environment in the country where people are not in their day-to-day lives being asked to, even if not comply with legal restrictions, still limit or restrict their own day-to-day behaviour. Ultimately, of course, as with many things in the life of governments, it will be a matter of judgment, and it's important that I get that judgment right, because I'm very, very serious and have been for 18 months when I say the biggest responsibility, the most serious responsibility on my shoulders is steering the country through the biggest health crisis in a century.
First Minister, you know me well enough to know that this is not the sort of thing that would cross my mind, but there are some nasty, cynical people who would say that the judgment you really want to make is when will it be more likely that you get the answer yes from a referendum? Because right now, the polls don't tell you, yes, we want a referendum, or indeed, if there were one, that you would definitely win. And that really, when you say COVID permitting, what you really mean is when it's politically advantageous to me, Nicola Sturgeon.
I think it's right for the country. Look, I'm not going to sit here as a politician and say that in any decision, I mean, we have fixed-term parliaments in Scotland, so it doesn't arise, and for the time being there are fixed-term parliaments in the UK, but when that wasn't the case, Prime Ministers, of course, used to make judgments on when they would call a general election based on when they think they could best win them. Any politician is going to factor those kind of judgments into those decisions, and I'm not going to sit here and pretend otherwise. Of course, some polls right now do suggest that yes would win. Others suggest that yes is slightly behind. I'm very confident that when this question is next put, people in Scotland will vote yes. And one of those reasons is that we have seen that all of the things that were said to Scotland by the No campaign in the referendum in 2014, not least that being independent would see us lose our European Union membership, have turned out to be false. So I'm confident about that. But my primary consideration, and the two are not completely divorced from each other. My primary consideration is to do what's right for the country. When is it right? I think it's right that the country gets to choose its future. There are big decisions that are falling to be made by governments everywhere as we emerge from this pandemic. Who do we want taking these decisions? Democratically elected governments here in Scotland, guided by the values of the Scottish people, or governments like Boris Johnson's in Westminster that we don't vote for. So that's the choice, and we should get to make that choice when the time is right for the country to do so.
Well, let's talk about the values of Scottish people and what an independent Scottish government would look like. I've seen the video that your party's put out ahead of the COP26 conference, proclaiming that Scotland is ready for net zero. Does that mean closing down oil production in due course?
We're in a transition away from fossil fuels, so oil and gas production is not going to last forever. The question is the pace at which we do that. I think we've got to see that pace accelerate. I think there are big questions over whether we should continue with new exploration in the North Sea. And the other question is, how just is that transition? Because what we don't want to do is repeat the mistakes of the deindustrialisation that was underway and that we had the legacy of when I was growing up, where individuals and communities were just thrown onto the scrap heap. So it's about the pace and the justice of that transition. We are already in that transition, and we've got to make sure that it happens at a pace that is consistent with our net zero ambitions. We have a target in Scotland to reach net zero by 2045, but actually we've got an even more stretching target, which is a 75% reduction in emissions by 2030. So there are big challenges for Scotland here, but there are big challenges for countries across the world. Glasgow is about to host COP, and this is possibly the last chance the world has to do what is required to meet the Paris Agreement of limiting temperature rises to 1.5 degrees. And we've got to get a Glasgow agreement that allows this generation of leaders to look the next generation in the eye.
You just made a very important point, which is that you've got to judge the pace, but what you don't want to do is to create more production. Now, does that mean that you have decided that the Cambo oil field, which I think is east of the Shetlands, which where there's oil companies have applied for a licence to drill, that you have decided that you oppose the exploitation of that field?
So again, let me address this, and I've set out my position clearly. Firstly, can I just factually correct your introduction to that question? The developers of Cambo have a licence. They've had that licence for, I think, 20 years. What they need to now do is get permission to start exploration and production. So the licence is there, which is part of the complication of the issue.
Forgive me,
it's not a decision
are you against bringing oil ashore from Cambo?
Well, I think that there has to now be a process of reassessing that. Now, what I was going to say is it's not my decision, it's a reserved matter. I've asked the Prime Minister not to simply go ahead and grant the permission to go ahead with production as a matter of course, that the licence should be reassessed against the same kind of climate requirements as new licences are going to be assessed. Now, there are issues here that have to be considered. The pace of the move away from fossil fuels, but in a way that doesn't throw people on the scrap heap, but doesn't inadvertently increase our reliance on imported oil and gas. So you're about to ask me to simplify this.
Your Green partners in government are pretty clear. They think you shouldn't. And I'm asking you, if you'd had your druthers, would you not have that oil field exploited?
I wouldn't give the go-ahead without a fundamental reassessment of the licence. That reassessment, the licence exists, so you have to do that reassessment. So I wouldn't give the go-ahead without that reassessment to enable that to be done against the requirements of climate change, so that there is that rigorous assessment of whether going ahead with new exploration, which I think many people and increasing numbers of people question whether that is consistent with our climate change targets. So that assessment, in my view, should happen.
Let me just quickly take you to a couple of rather controversial issues, I think, that your government's addressed. You've issued guidance on racism to schools, which advises teachers to take a test to measure their white privilege. Have you taken that test, First Minister?
Sorry, I haven't. I'm happy to do so. But you know, if you want to give me more detail of that, I will certainly consider it. But I'm not entirely off the top of my head sure what you're referring to.
Well, it is a test which says, because of who you are and how you're born, you have privilege in your case, which I, in my case, do not have. And the advice that your Department of Education has given is that schools should give, that teachers should take this test to demonstrate that they, because they're white, have this advantage. And I think it would be rather good. I mean, why don't we do a deal that the Scottish Government Cabinet takes the white privilege test and one of you or one of your colleagues comes back on and tells us what the results are?
I'm happy to do. I think these things are really important. I don't have the particular guidance in front of me. I'm not trying to dodge your question. I did an interview with one of your competitor channels on Friday about many of these issues, and as we consider all of these issues, people like me, white people, have to constantly remind ourselves that we have privileges that others don't have. So I'm perfectly happy to go away, look at the particular guidance, and if there are things that my cabinet should do to make sure that what we're asking others to do are things we're prepared to do ourselves, I'm happy to do that. That's
a date. Very last, very simple, straightforward question. A lot of work on the gender reassignment issue. Do you agree with the most famous Scottish-based writer J.K. Rowling that there is a biological basis to sex and that you, for example, are a woman? Not a person with a womb, but a woman. I am a woman, and yes, I do think there is a biological aspect to sex. I'm not going to simplify this by sort of saying, do I agree or disagree with J.K. Rowling? There's many things I agree with her on. I'm sure on some of the nuances of this we might take a different opinion. But let me, address directly the issue of the Gender Recognition Reform Bill, something that's happened already in many other countries, Ireland included. This is about making it easier for trans people. They can go through this process already, but it's about making it less degrading and traumatic for trans people to legally change gender. It does not in any way, shape or form remove the legal protections that women have, and that's important to me as a feminist. But trans people are amongst the most stigmatised minorities in our society, and we should try to reduce that if we can. But also there are real threats to women across the world right now, from abusive men, predatory men, misogyny, sexism, places like Texas trying to reduce the right to abortion. Let's focus on the real threats to women's safety rather than things that might be perceived threats, but in reality, in my view, are not. Right. First Minister, much appreciated. Thank you very much. Thank you. That's it from us for this week, but stay with us now for The Take with Sky's Deputy Political Editor, Sam Coates.